Welcome. I'd like to welcome everyone to the June version of the monthly policy forum. We have a lot to report on this month, so we'll go ahead and dive right in. The chat is open. I'm going to have Chris, if you can wave your arms and say hello, monitor the chat and keep us on track with what's going on with the chat. And we've got some kind of fun things we're going to spice the call up with today. So without further ado, I'm going to give you a little update. My name is Jen Wisdahl. I'm with FASD United, for anyone in the country that doesn't know me yet. And I say yet because I'll get to know you, I'm sure. Here's what's going on with FASD United very quickly. We are asking folks to save the date if they're able to travel to DC for National Impact Week. This is inclusive of our affiliate summit, and also there's some activities for folks that aren't affiliates, folks that are advocates or self-advocates involved in FASD. We'll be having a workshop on widening the circle, how to involve more people into the field of FASD from a diversity and inclusion standpoint, but also just broadening it in general. We'll be having a national research briefing, the state of the science, and then a Hill Day where we go up to the Hill and we work on getting some meaningful legislation for people with FASD passed. And that's September 18th through 21st. You can find information on our website. The other big piece of news that I'm thrilled to announce, and you've probably already seen this, but there was a conference that was held by the ALC FASD Change Makers. That's the Adult Leadership Collaborative of the FASD Change Makers, a group of adults with FASD that has for many years ran a research conference up in Vancouver, British Columbia, Canada. And what was unique about this conference is that the adults with FASD informed what the researchers were talking about. So this was a way of directly connecting and informing research to the needs of the FASD community. And we are extremely proud and grateful that we are able to partner and collaborate with the change makers and are bringing the Vancouver conference back. It was canceled due to COVID and some changes in the university that was hosting them. And we're bringing it to Seattle coming in 2024. So look for some announcements on that. And if you haven't seen it already, we do have a survey that is intended to inform future policy pushes on education and FASD. You can link to that again through our website, or there's a link down below. Maybe Chris, you can throw that in the chat. It's a quick 7-minute survey. We do have a section that if adults with FASD or students with FASD would like to complete it, and also a section for educators and people involved in the education system, as well as parents, and looking at education nationally. What's this looking like? Where are we at? Last but not least, registration is open for Run Fast. This is a great way to celebrate FASD Awareness Month and participate in a national virtual 5K. Nobody is measuring how fast you're going, or even if you're completing the entirety of the 5K. I'm not looking at myself there, but it is a great way to build community. There are a number of organizations that are actually hosting in-person meetups to be able to do this together in their communities. And it's just a fun way to proactively and positively celebrate FASD Awareness Month. And Susan, do you have any updates you'd like to share from the affiliate network?
Good afternoon, everybody. This is always such a fun meeting to attend because you all are so inspiring and passionate with what you do. In picking up and dovetailing on Jen when she was talking about the work the affiliate network is doing in broadening the circle, we are interested in and actively looking for individuals and groups who would like to join the affiliate network. If you are associated with a group who has an interest in the FASD efforts, making progress across the country, look up information on our website about how you can be affiliate or reach out to me. My email address is right there on the screen, and I would love to set up a chat with you. And that's it from the affiliate world.
Thanks, Susan. All right, so stepping into the bill, this is the main event why we're all here today. We've had some exciting things happen with the bill since last month. Namely, we've moved the arrow. The bill has been introduced, and we've been assigned bill numbers. So HR, and this is going to take me a while to get this, 3946. And Senate Bill 1800, or as Susan puts it, Susan Shepard Carlson puts it, 1 + 8 = 9, 9 months. That's our Senate bill. So very excited to be making progress there. And we were introduced earlier than last legislative session. So we're already a little bit ahead of the game from where we were last session. And just a reminder that the Congress that we're in, the legislative session that we're in, lasts for 2 years. So we have 2 years to get to step 9. And there's multiple paths to get there. This is a very simplified version, but every month we're going to kind of check back in and see where we're at. So Susan, do you want to talk about a little bit more about bill status?
Oh, well, I mean, there's really, it's been introduced, and if you haven't signed up for Congress.gov, you can get emails with updates. And I got one in my text. We've been waiting for, or I got an email this morning. We finally got the text in the House. If you go to the House 3946, you can find the text. I did, because we've been waiting. This is really long time to wait for text to get onto Congress.gov. So I checked with Klobuchar's office, and she told me that they were behind because she thought it was because of one member who had introduced 800 bills in one day. We don't know who that was, but they're very behind, and she hoped, that we would get it done, by the end of this week or next. I don't know why the House got introduced or got there before the Senate, but at least I do need to say that it's the same language in both bills. So you don't have to worry about that. It is the same language. And these are our confirmed authors and sponsors. And then unlike last year, we have original sponsors already signed up. In addition to the lead sponsors in the Senate, we have Senator Moran from Kansas and Senator King from Maine. So you don't have to do your, I'm sorry, those from Kansas and Maine, you've already got yours done. And I think it's because you've been so good. So, but that's just
halfway done, because you've got 2 senators.
Well,
let's all do the dance together. 2 senators and 1 rep.
And we do, and let's see, they've been introduced, and we're going to, and I did ask Klobuchar's what's our next steps, and both of them, both House and Senate staffers have said, get your sponsors introduced. So that is our step right now. It's a great time to do it. So we're stepping that up.
We got to get our co-sponsors on board. So yeah. So to that end,
have you heard anything?
Oh, sorry, go ahead, please.
Could I just ask a question? Have you heard anything from Senator Stabenow? Because she was a original sponsor before.
We have not heard anything. I did get to sit in on a last-minute meeting that was done by a constituent with her office. So hopefully we will hear something back soon. So, and I've got some more information about that a little further on too.
And
okay.
And to that, Jen, both on the House and Senate level, they sent out information to their health list, but then they also are going to forward to the co-sponsors from last, and we talked about that before, to the co-sponsors from last Congress. So And this is a much easier ask than a 64-page bill. This is only, what, 7 or 8 pages, so. And if you go to the policy website, there's a section for legislative staff resources, and there's the link for the bill text. There's a these are all up, the national agenda is updated with bill numbers, and there's a summary and rationale, and it's a little bit different than last year. It's got bullet points on the summary, on the rationale background, and then everything that we thought that you would like to know, plus what staff members would like to know. And then there's it's a summary of the bill in more layman's language. And then optional documents there. You get a lot of inquiries from staff on appropriations, previous history. And then one of the things I found helpful, because this bill is a little different than the Respect Act. You could read the last Congress, you could read that bill and kind of understand what it was doing, but this amends the expired code provisions. So what I did was incorporate the language that they were amending into that old code, so you can look at it and read it and see what it's doing. So I think that would be helpful for staff as well. And then there's a one pager that the office is put together. And there's the child welfare report and TEP report, and we had those last time. So, and then there for previous co-sponsors, and I think you'll get this question as well for those that are previous co-sponsors. There's a comparison document between the Respect Act and the new Respect Act.
Yeah, and we'll be sending that out to any previous co-sponsors offices. We're going to be doing a bulk email out to them that has that document attached, and just asking them for their support again. That doesn't mean don't reach out to them. That means do reach out to them as well and send them the same document. But I do want to caution and give a word of advice on this. If you were to send all of those documents to your legislative staffer, they're probably not going to listen to you, quite frankly, because it's just too much stuff. So what I might suggest is either sending the state data sheet and the bill one pager, or the summary and rationale in the state data sheet, or, less is more ahead of your meeting, because they're not necessarily going to have time to go through all of it prior to the meeting. And then during the meeting you have with them, see if you can suss out what areas they're most interested in. Are they most interested in the money? Okay, well, then you can send them the history of FASD program authorizations and funding. Are they more interested in just the facts, ma'am? Okay, send them the one pager, right? Are they interested in child welfare? You can send them the child welfare report. The TEP report was done under a full Republican administration. If that's something that's important to them, send them the TEP report. Like there's different things that you can send based on your audience, but just don't dump it all in there, because they're just going to write you off, and it's not worth doing. So pick and choose. You know what goes best in your area. We're not going to tell you have to do these things. What we're saying is these are kind of our suggestions, and you can pick through and see what's going to work best for your legislator. But these are documents that you can send either before the meeting to get the meeting, or after the meeting, right? These are documents that you can send just to stay in touch. Hey, I just want to make you aware of this. So we're going to be continually working on these. So we do ask that when you're sending them, try and get them off the website, as opposed to saving them onto your computer and sending them from there. Like I said, we're constantly updating these, and fresh copies are always better. So, and again, to find these, you go to the FASD United website under the Policy Center, FASD Respect Act, staffers' resources.
And
And you can link.
And for self-starters, you could just, if they really are, want to have a lot of information, just send them a link and tell them that they can go on there and tell them exactly what Jen did.
Yep.
And you can-
Just send them a
Jen-
link directly to the For Staffers page.
Yeah.
Jen, we have a quick question from Carl in the chat, just asking
Mm-hmm.
if the child welfare report includes Indigenous people.
I'm trying to remember off the top of my head, and I'm sorry, I don't. Susan, do you know?
Well, I'm not
Is it-
sure what Carl's, what it was. They did a study in 5 areas and looking about prenatal alcohol exposure and how it's dealt with in child protection. So not specifically about if,
No.
and I don't think they
Okay.
named
Well-
the 5 places. So
Okay, I was just asking because there's some of our elected officials are more inquisitive about the tribal nature because they need tribal support and they support the tribes. I know in North Dakota and Montana specifically, some of the legislators are more apt to support things if we can separate out and show them that that number is a significant number because they want to help tribal people. So, but that's just my experience.
well, the fact
Thank
that
you.
the fact that they're in child welfare and it's looking systemically at child welfare and how it's not recognizing prenatal alcohol exposure and screening and treatment. I think
I just know that that's a question I'm going to get at least from Senator Kramer,
Yeah.
and probably from Senator Tester. So, yeah, but yes, and to answer the question in chat, yes, I have talked to Dr. Bird about it, but I need numbers, hard numbers, and he hasn't been able to get me that information.
Okay, so just a very brief update on meetings that have been had. States where you have one senator sponsoring, and then states where we've had meetings with senators. Meetings are shown in blue, one senator sponsoring are shown in yellow. If you've had meetings that aren't marked down here, please let Chris know or myself know, and we'll get that added on for next month. And we really are trying to keep track of this. And then also house meetings where we have sponsors and where we've had meetings. So we've got a lot of opportunity to to do meetings, but I don't know if you remember last month, we showed a map of all of the places and legislators that we met with last year. And there was a whole lot of color on that map. So I think we're able to bring that up to speed fairly quickly because we all know what we're doing now, right? So what do we need to do now? If you can make it to Hill Day, we'd love to have you there, but in your state, again, we need to start booking our legislative meetings. And we are there to support you every step of the way with the meetings. Chris is going to be our point person in terms of person to connect with to coordinate either having Susan or I available on the calls, doing practice calls, things like that. But what we wanted to do today is really go into a deep dive on these legislative calls and how to make them more effective. So to that end, I've invited a few folks to do a mock call and show you how other parts of the country, other people might be doing these calls in a way that is particularly effective. And for those of you who haven't done any of these legislative calls yet, this is an opportunity to demystify the calls and see what they're like. So today, playing the role of our legislative staffer is going to be Mike Kavahi Anderson. And you're going to notice his camera is off. And there's a reason for that. So we'll get into that a little bit as we go.
So I can multitask. That's why.
Exactly. Playing the role of our host. So someone in the position of either getting the call or someone in the position of supporting a state or a specific area is Rachel Singh from the FASD network of Northern California. playing the role of a subject matter expert, because sometimes we like to bring a subject matter expert onto the call, is going to be Sid Gardner from Children and Family Futures, who also works with FASD now, along with Rachel in California. And then I'm going to be the parent or the constituent in this particular case. And then we've got Susan Shepard Carlson playing the role of Susan Shepard Carlson. So we're going to get going, and I may pause us along the way just to point out some particular highlights, but we're going to try and race through this fairly quickly because we've got a lot more content to get to. If we don't, what we'll do is we'll plan on bringing that content forward either to the next meeting as it's applicable, or doing a separate meeting for that content. So I'm going to go ahead and stop sharing my screen so you can see the people that are speaking. And if I can ask for everyone, if you are not a speaker, to please have your screen muted or your speakers muted, that would be extremely helpful. So without further ado, I will turn this over to Rachel.
Thanks, Jen. And just quick shout out to FASD Now and everyone who has been collaborating in our state. We work together to generate this script. So I see Annette. Hi, Annette, and she's been a key player in this. So I will start. Welcome, Mike. Thank you so much for meeting with us today. We know you have many demands on your time, and we appreciate you fitting us into your schedule. I know you received some advanced background information from us, and if you haven't had time to review it yet, no worries. We're here to provide you with key information about the FASD Respect Act, HR 3946, and to offer some insight into FASD, which stands for Fetal Alcohol Spectrum Disorders. After our meeting today, we hope you'll convey this information to Representative Smith and seek her support as a co-sponsor of the bill. We know Representative Smith is committed to bipartisanship, fiscal responsibility, as well as protecting and providing for the most vulnerable among us to ensure everyone has an equal opportunity to thrive. And the FASD Respect Act embodies these values. We want you to know that here in Northern California, Representatives Huffman, Lee, Lofgren, Panetta, Swalwell, and Thompson, among others, have already signed on as co-sponsors. Representative Eshoo has written a strong letter of support, so we want you to be aware of that. Let me first briefly share with you who's on the call today. However, before I do so, Mike, it would be great if you could tell us a bit about yourself.
I've been with Congressman Smith for about 3 years now. Health portfolio is my portfolio specifically. I am aware of what FASD is and so forth. I'll have some questions later, but we'll just start with that.
Wonderful. Thanks, Mike. And it's terrific that health is one of your areas of interest and priority. So on the call, we have Jen Wisdahl, one of your constituents and a parent caregiver of a child with FASD, in fact, 3 children. And she will share some of her family's powerful story with you. We also have Sid Gardner, president of Child and Family Futures, a national organization based here in California, devoted to infant and child well-being, maternal health, and family preservation. Sid will provide the critical perspective of a professional with deep expertise and experience in cross-sector collaboration and systems change. He'll provide additional insight into what is needed in our state on a systems and state level to address FASD. We are fortunate to also have representatives or a representative of FASD United, the national voice for FASD that coordinates advocacy across the country and is the organization in the US that addresses FASD on a national level, partnering with agencies like the CDC, HRSA, NIAAA, DOD, and NIH to increase awareness and policy responses regarding FASD nationwide. Former First Lady of Minnesota, Susan Carlson, who's with us today, has been a tireless advocate for FASD for decades and is the chair of both FASD United's Legislative and Policy Committee and FASD United's Board of Directors.
Oh, that's, no, wait a minute, is Susan on?
I am.
Yes, she
Hi,
is.
Susan. Is your husband Arnie? Is it Arnie Carlson? I mean, Arnie is your husband?
Yes, yes.
Oh,
he was
great.
governor.
It's good to meet you, ma'am. I've heard a lot about you. Thank you.
Oh, well, you're very kind. Thank you.
All right.
And do you know Barney, Mike?
Arnie, yes, I do. I remember meeting him at an event several years ago when I was interning for Representative McCollum. Yeah, that's great. Thank you.
Oh, wonderful. And Representative McCollum is one of the co-sponsors. So this is,
I know that, and I'll have to talk with the staffer there that took over who has the health portfolio. Thank you.
okay, well, Susan's been closely involved with the crafting of this legislation and working with folks in both the Senate and House on both sides of the aisle to keep it advancing. She will be filling you in a little bit later about some of the details of the bill.
Okay.
I'm with an organization, FASD Now, which is an alliance of service providers, organizations, experts, families, and self-advocates from across California, advocating for FASD to be addressed in our state. In addition, FASD United has affiliates across the country, and I'm on the board of the affiliate in Northern California.
Great.
I'm also the parent caregiver of a young adult with FASD, so this issue is quite personal for me. You mentioned, Mike, that you are somewhat familiar with FASD. We don't want to take up too much of your time with a quick overview if you're very knowledgeable about this disability.
Can you remind me of what the incidence rate is nationally? And if you've got any data, I know you may have sent me some information on that, but I haven't had a chance to look at it. I'll look at it more in detail later on. But for the incidence rate for California, just my member will be very interested in it. Representative Smith will be very interested.
Absolutely. I mean, as you may know, it's one of the, if not the most common developmental disability. And nationwide, the most reliable data is 1 out of 20. And so in California, that would mean that at least 2 million children and adults are currently affected. However, few of them have an accurate diagnosis. There's a lack of diagnostic capacity, and obviously equally few receive appropriate services.
Okay.
So,
thank you.
yeah. And I assume you are aware that alcohol is absorbed in ways in a pregnant person's body that are different than other drugs like opioids and methamphetamines. And in fact, the impact and effects are much more profound and long lasting than some other drugs that have been much more on people's radar.
Very aware. Thank you.
Okay, thank you. So you also probably know that the outcomes in terms of FASD are so much better for children if there's early intervention. And so that's another thing that we're really advocating for, and this bill will help support.
Okay.
Did you know, Mike, that some of the pioneering researchers of FASD are here in our state?
No, I was not aware of that.
Yes. In fact, one of the people we call the father of FASD is at UC San Diego, Ken Jones. And he has trained numerous other researchers and medical folks in FASD. So it's rather ironic that we have the pioneers of research on FASD in our state, and yet we are not as responsive to this disability as states like Alaska or Minnesota. So let me turn it over to Jen, who will share with you her story. And then you can see if you have any questions for her. And then we'll hear from Sid, who can give you a more systems level perspective. So Jen.
Yeah, and I'm afraid my time's going to be short here. So if we can kind of move this, I've got to support the congressman. We're going to go to the floor here very shortly. So if you could do that, that'd be great.
We will move it right along for you. Jen, take it away.
Well, Mike, thank you so much for meeting with us. My name is Jen Wisdahl, and I am, in addition to being the proud parent of 3 teens and young adults with FASD, I am a constituent of Representative Smith, living in Ording, Washington. We're switching states now. My children attend school in Ording, and my husband and I own a house within the representative's district. I want to talk to you a little bit about my eldest son. I was his 5th mom in 5 years because his behaviors due to FASD were so misunderstood in the foster care system. And unfortunately, in our state, there isn't training available for foster parents to understand what FASD is and how to support them. None of our systems of care, including DDA, Medicaid waivers, the school system, none of them have a deep understanding, any understanding in most cases, of FASD. What we hope this bill will do, and what we know this bill will do, is help provide impetus to the state to begin looking at those siloed systems of care and how they can invite FASD in. Right now, there's nothing authorized for FASD on the federal level, and authorizing FASD through this bill will send a great signal to our state lawmakers so that we can begin really working on this both at a federal level and a state level. So I really encourage the Congresswoman to support, endorse, and co-sponsor this bill. It would mean the world to my family and my husband and I.
Thank you so much, Jen. And Mike, if you feel a need to reach out to your constituent, down the road, I know she has much more to share. I would like you to hear from Sid briefly, and then we'll make sure that you hear from Susan as well. Sid, take it away.
Very briefly, the good news about FASD, as you've heard, is that we've got this national legislation pending. We're building the body of information we need to understand the issue. But the other news is that at the state and local level, as you've heard, we aren't really pulling the pieces together. We've looked at the state of California as an example, learning from what Alaska and Minnesota and other states have done. And there's over a dozen agencies in the state that are now involved with FASD, either in prevention, early intervention, or responding with services, or they should be involved, but aren't. And so pulling that legislation together, the legislation enables us to pull agencies together at the state and the national level. The FASD Respect Act would give us an umbrella at the national level to mirror and help guide similar umbrellas and coordinating efforts at the state and local level. We've studied the California state agencies in some depth over the last year and know what they can do and what they aren't doing. One of the biggest questions is, as you asked at the beginning, what's the incidence? What do we know about the percentage? In some states, we have data down to the county level. In other states, hospitals don't ever add up the number of alcohol exposures that they detect, or prenatal providers may not be asking the question in an appropriate way. So we stand ready to provide you with answers to any questions. FASD United is a terrific national resource with state affiliates across the country. And we're, I think, rich in resources to respond to questions that the congressman might be interested in.
Thank you, Sid. Mike, any questions for Sid?
Hey, Sid, where are you from?
I'm working in California. Our national organization is based in California. I reside in Las Vegas, Nevada.
Okay, thank you.
Thank you so much, Sid. Mike, I know you want to hear from Susan Carlson. So Susan, the mic is yours.
Hi, Mike. First, I know you've heard a lot. So do you have any specific questions about the legislation before I go into?
Yeah, I did take a chance to go over the legislation in detail. I haven't talked it over with either Representative Bacon or back in my old office in Representative McCollum's staff, and I will. If you can later on, one of you email me as to who those exact staffers are, then I'll just go right to them. But the question I had in looking at this appears to be codifying, if you will, some sort of national structure under a national centers of excellence. Is that what this legislation seeks to do?
That's part of it. FASD programs were first authorized in 1998. Okay. And 27 million was appropriated in 2001. And part of that funding went to the Centers for Disease Control and part of it to SAMHSA for a Center for Excellence. All the funding, the authority expired, the authorizations expired in 2007. And there's been a bill to reauthorize since then. And
so we've had no reauthorization since then?
There has not been a reauthorization since it expired. So this reauthorizes and adds new language, and it brings back the FASD Center for Excellence, as well as funding for what we call building state and tribal systems of care. And I think Sid did a good example of explaining that, because my experience, I started this 2.5 decades ago as when I was First Lady and also a juvenile court judicial officer. And I saw how our systems of care really are not understanding or recognizing this disability in juvenile court, education, you name it. And there are lots of funding, as you well know, the federal government funds a lot of programs related, you would think would be related to FASD, but FASD is not included in most of them. So it will allow states to begin to look at all those silos of systems of care and figure out in prevention or intervention how FASD would fit. For example, any mental health programs or substance abuse programs or prenatal screening. And so we'll be able to access that funding in a systemic way. And then the Center for Excellence would provide that technical assistance to states and the country as a whole with using what we've learned across the country with research and being able to replicate that in other systems around the country.
Okay. One of the questions my Congress, I don't know if it's a woman or a man, but we'll figure that out. Congressman Smith is going to ask is, particularly as he or she has been in the brewery business on the long term, isn't this preventable? Isn't all of this preventable? And how do we address that? How do we go to see how are you all addressing this as a preventable type of disease, if you will, or the incidence, if you will?
Can I answer that one, Susan?
Yeah, keep smiling, Susan. I know that's a tough question. Keep smiling.
We'll
Never
let
stop letting you
Jan
sweat.
answer that question.
So, as a constituent and as a parent, this is something that you absolutely think about. But what we know from the research is that FASD can be caused prior to recognition of pregnancy. And with late recognition of pregnancy. So yes, absolutely, there are public health messages that can and should be delivered to everyone, giving them the right to know the risks of alcohol use during pregnancy. And those activities have been ongoing over the years. If anything, that's the one thing that's really remained consistent. But in areas where there's lack of medical care, lack of prenatal care, lack of nutrition, food deserts, those are areas where FASD can also happen. So, yes, those messages, those public health messages do need to be out there. And yes, this legislation would help with that. But I think at the end of the day, what we see is there really isn't anything out there supporting people living with FASD. And at a rate of 1 in 20, Mike, that's a kid in every classroom. And then that's if your classrooms are really small. So we really, are looking at this as, yes, absolutely. There's some great public health messages that need to go out in regards to alcohol and pregnancy. And this bill helps with that. But also what it does is really closes the gap on that supports and services for people living with FASD, who are some of our most marginalized because there really isn't anything there. None of our systems of care recognize them or know how to support them in a way that allows them to reach their best future.
Jen, I'd like to piggyback on that, Mike. You might not be aware that actually, and Dr. Kenneth Jones in California is trying to elevate this data, that the prevalence of alcohol use during pregnancy is the highest among college-educated, higher income white women. Now, the effects may be more serious in communities that have less access to healthcare and other resources. But in fact, the prevalence of drinking during pregnancy is highest among college-educated white women. And that's contrary to a lot of assumptions that some of us might have. So sorry to piggyback.
Oh, excellent. Thank you. I have one more question with respect to this, and then we'll probably have to move on in the interest of time. I see this in, how is this going with the appropriations? We can authorize this, but what help and who have you been talking to with respect to getting the funding for the specific funding? I know 27 million, I suspect that's down and it's separated out in all different kinds of rice spots, but how can we help with that?
Okay, so, and that's the bottom line, right? And we're connecting with the staff from both, on both the House and the Senate appropriation staff and providing the data. You know, there's, like I said, there's a lot of funding that is going to pockets of funding that really, if you were more targeted. And so we're hoping to look at those sources and suggest areas where we might be able to access some of that funding.
Well,
but
Congressman Smith's very good friends with Chairman Jones on XYZ appropriations, and would be very glad we could work something there to help you out. So
yeah,
okay.
whatever he can do to help us in that regard would be fabulous.
Okay.
That would be fabulous. Mike, I want to be sensitive to your time, and we are so appreciative for your clear interest in our effort and your offers to help. So we will circle back. We will definitely get you the staffer names for McCullum and Bacon who are working on this. And I know Susan will follow up with some other information. Any final questions for us before we wrap
No,
up?
just, hey, Susan, tell Arnie I said hi. I really appreciated the opportunity to get to know him and meet him. And you all have been great. So thank you so very much.
I will do that. Thank you so much.
All right.
Thank you, Mike.
It's a pleasure.
All
Just a note
right.
to everybody, never let them see you sweat. And you know, if you notice, I asked, that is probably the hardest question you're going to get asked, is the one I asked.
The
And
appropriation.
if you notice, and appropriations too, and you notice Susan did not, typical Susan did not break hers. I watched, I'm sitting there going, okay, Susan, break that smile. And neither did Rachel, and neither did Jen, and Jen stepped right into it with the approved answer, by the way. So think through what are going to be the toughest questions you're going to get asked, possibly, and then figure out, okay, how are you going to deal with that, and never let them see you sweat. Never. You don't need to sweat.
Yeah, and we were a little rusty because we haven't done, I mean, I don't know how many we did last time, but so we were a little rusty, but yeah, thank you.
That was good.
Mike.
Well, and Mike, I have to say it was spot on. We've had meetings where you can tell the staff are multitasking and they're facing this way and they're typing away, and you just have to keep going. And then the screen will, they'll turn their camera off. So Mike, you really
just like I did that with Jen intentionally, the most emotional part of the meeting, right? And Jen's speaking to a blank screen, and Jen's just, I'm listening, by the way. I'm not doing any multitasking. I have one screen over here, the big screen, and over here's got everybody on it. So that's why you see my head changing. But you've got to, but somebody's also got to be taking notes, when a nod, that means you made a point. Watch. The nice thing about Zoom, folks, is you can see everybody's face and their reactions all at the same time on a little tiny screen that you can do that. So you can see if they're agreeing, they're kind of scratching their heads or tilting. All those body language cues are extremely important to pick up both in person and visual. And then when they go off, don't sweat it. Just keep pressing with your message. You keep pressing with your message. Good job on that, Jen, and everybody.
Well, and I want to bring up a couple of points on this call that we've seen be particularly effective with this format. Number one, the information that Sid and Rachel piped in with after I was talking about food deserts and, alcohol exposure prior to recognition of pregnancy, bringing in the point that it is middle-aged, middle income white women with college degrees where this is happening, right? That brings it home to many of our legislators. That's a really good point to make. And you notice that it wasn't overly dramatic. Like I did say, I was my son's 5th mom in 5 years, which is true. Absolutely. And that the systems of care didn't understand and it was really hard. But you notice how I tied it back to and here's how the bill will help, right? And there are going to be some cases where you have a constituent on the line, or you are that constituent and you just get really emotional, and a lot of our constituents cry, and hey, that's really normal. I did it the first, like I've cried on these calls too, because the stories were so touching. But the overall gist of the call was not one of, oh my God, this is so terrible, it's a tragedy, it's horrible. The overall gist of the call was, there's a problem, and this will help solve the problem, right? And that's the message we want to convey, because we really want to convey that we can do something about this. It's not impossible. It's not just a sob story. There's a problem. Here's a partial solution. And to Sid's point, and you'll notice some things that Sid said there too about how, they're working with the state, they're looking at the systems. We're willing to do the work to leverage this funding. So, that's not going to be the case in all states, and that's okay. You can still do these calls, you can still make those connections, it can still be effective. But those are some really great points that if you're able to make them, they're just part of the sales pitch, as it were. So,
well, and then also I would say, if you've done your research on your representative, they have particular experience, like if they were a prosecutor or they were social, whatever it was, you try to bring something in. And I thought Rachel did a good job of laying the groundwork on that. And every call is going to be different. I mean, this was pretty, as I looked at it, I think it was a well-done version of a lot of the calls that we did, but you don't know.
So we have about 10 minutes left on the call, and I did have another segment prepared, looking at more in depth at how we can organize states, right? So it's one thing to go out and teach all these people how to connect with their 2 senators and their 1 rep and do it individually. It's another thing to look at how can we activate a state and get everyone in a state out there doing the same thing, or how could you as an advocate, if you've already hit up your 2 senators and your 1 rep, how could you affect change and really start advocating on a state level, right? Taking it beyond where you're at. And Julia Rivera came up with a really great document and some keys on doing that. And so Julia is with FASD Network of Texas, or Texas FASD Network, sorry. I'm probably getting that wrong both ways. So Lynn and Julia, please forgive me there. But the Texas group participated in a massive amount of calls in Texas and really were helpful in getting those calls going in areas where there might be a constituent, but they weren't comfortable necessarily getting it all done themselves. And so to do justice to the information that Julia put together, I think, maybe we can do a quick poll. Would you prefer we save it to the next policy forum, or would you prefer a separate meeting? And I'll just pop a poll up here just in a quick second here, and you can let me know what you think. So we can all sit here and watch me type, and that's highly entertaining.
Jen, while you're typing, I've got to go off to another meeting. But it was great helping out today. It's always fun to get on a monthly call. So y'all keep doing, you're doing the Lord's work, and it's very important. So thank you very much. Appreciate being included on the call.
Thanks, Mike.
All right, and I'm going to launch the poll now. So this is, we're asking, hopefully you can see it. Let me know if you'd like a separate call for this training on doing it overall in a state, whether you'd prefer a separate call or you'd prefer to wait till the next policy forum. And I feel like I'm watching a horse race because it's kind of neck and neck. Any questions on on the mock call that we had, or any things that have come up on calls that you've done that maybe didn't come up in that call?
I just wanted to say that was awesome. That was a great job. I don't think I could do it by myself. So just to see you guys as a team, I mean, it's powerful. So, I mean, I definitely would need all the help and support because I don't think I could do that by myself. So kudos to you all.
Thank you. Thank you. And I think you'd be surprised at what you can do on your own. And maybe we need to do a mock call where it's just 1 or 2 people on it to show maybe a different style of doing it. So I noticed that Marilyn had her hand up, and then I also noticed that Barb has her hand up after that.
I thought that was really well done. The only thing I was missing was lived experience story, which I have felt was the most engaging for the people that we're talking to. So bringing it to, like, if you had told a story about one of your kids, then it would really explain what is the problem. The problem isn't a bunch of statistics. Well, it is too, but the problem is how these kids end up living their lives and how difficult it is.
Yeah.
So I don't, what do you think? I mean,
Well, and
Absolutely, yeah.
Very briefly, I brought on I was my son's 5th mom in 5 years because of the extreme behaviors he showed as a result of the disability. But you're right, I was trying to truncate that down into a very short time period because we were running a little over on the call. Along those lines though, Marilyn, too, one of the things that is absolute gold and almost never results in a lawmaker not signing on, like our lawmakers almost always sign on when we do this, is if we can get an individual with FASD to come on the call and talk about their lived experience, not the parents' lived experience, their lived experience. And that is incredibly powerful. So, if, and we've had young kids, teenagers, adults, it's powerful. So really good point though, Marilyn. I think personalizing it and showing that lived experience is really a key factor in this. So you're absolutely
Marilyn,
right.
just so you know, because this was so real time sort of synergy. Mike threw us some curveballs. There was part of my sharing where I do share part of my story as well. And you're absolutely right. That's often what brings people in. And then you sort of have to make that split-second decision about, okay, what am I going to include? What does this person seem to be most interested in? And, making sure that there's plenty of time for him and Susan to connect, because clearly he made a connection there. But you're so right. And I think I know Jen has a much longer version of her story, but
okay.
that lead in was compelling. But thanks for mentioning that, because it's absolutely true.
Yeah, I just wanted to say that once I've talked to one staffer twice. The first time she never even looked at me. I mean, and the second time I brought out the photos, I told the stories, and I didn't hold back. And I tell you, I had her the whole time. And it was a big difference. So, and everybody's different. I have some quite the stories myself, and not everybody does, but I think that's the power, is the storytelling. Thanks though. Thanks. It was still great. And I don't know that I could be as professional, but I can just only speak from the heart and my experience, and that'll have to speak for me. Yeah, thanks.
And Barb, you had your hand up. Oh, and I think you're muted.
I'm sorry.
There you go.
I'm just having this conference in Michigan on September 12th and 13th. And I'm wondering how I can use that conference to help. And I had already asked you and Susan, and neither one of you can come, which is disappointing, but I understand you all need a break and a vacation too. But do you have some ideas that you think are key that I could do? At one point, I was going to have everybody write letters that were there.
A short video snippet could work too.
A what?
A short video snippet. You could do like a quick 1 minute video, a short form video of them introducing themselves and why support for FASD is important. That could be a really powerful advocacy piece that could be passed along to legislators. Yeah, I think we could brainstorm on that, Barb, and see, you know, if there's any other ideas or suggestions or ways of elevating their voices in a way that is helpful and meaningful to them.
Okay, so you're thinking the video would be used at the conference? Is that what you're saying?
Well, I'm thinking that if at the conference, your youth with FASD wanted to do a short video of, you know, introducing themselves, where they live, and why support for people with FASD is important, that could be
So
a
maybe
powerful video comment that we could send along to legislators if they weren't interested in perhaps writing a letter. The other thing you could do
Okay.
is during that conference, maybe plan a couple of calls with legislators and have a call there at your, you know, set some time aside and have a call with your conference. So yeah, there's, I think there's all kinds of different ways of making that happen, and maybe offline we can brainstorm a little bit on how to do that.
Okay, thank you. I don't want
You're
to take
welcome.
up any more time.
No worries. Well, we're at the top of the hour. The poll came in, and it looks like most people would prefer to do the segment on state organization at the next policy forum. So we'll make sure we set time aside for that. But in the meantime, if you have any questions, comments, thoughts, ideas, you know, please do reach out. Chris is kind of running point in the office. You can reach out to Chris, you can reach out to me, and we will do our best to get back to you as quickly as possible. All right, so thank you all for being here. We really appreciate your time.
Yeah, everybody.
Thank you.
Thank you.